Neonatal Intensive Care Nursing by Caitlin, Zoe, Abigail, Mariah, and Michaela.
We chose NICU nursing because the only person that is stronger than a NICU nurse is the little warriors that they are saving. Our objectives for our presentation is to conduct an interview with a NICU nurse, discuss the evolution of NICU nursing, describe a day in the life of a NICU nurse, and talk about the benefits and challenges of NICU nursing.
This is our interview with a NICU nurse that Caitlin and Michaela did, but we did interview Diane Hemp, and these are her answers. Hi, Michaela. This is Caitlin. I'm just going to be interviewing you today about your job as a NICU nurse.
Okay.
The first set of questions I have is just about your job and kind of what your position is like. So, first one I have is, what is a typical day like for you as a NICU nurse?
I have 1 to 3 babies, and it just depends on how critical of care they need.
What do you specifically do?
I take their vitals hourly. I monitor their I's and O's, give tube feedings, and I also watch the monitors.
About how many hours do you work in a typical week?
About 36.
For the next set of questions I have is, why did you choose to be a NICU nurse, and how did you get there?
After graduation, I really wanted a field that was specialized, and this was the first job I saw, and I stayed because I knew that I would be making a difference, and I was able to build relationships with the families.
How much education, clinical experience, and did you need any certifications to become a NICU nurse?
I did not need any certifications, and all I needed was a diploma after graduation.
What skills and personal attributes are most important for being successful in your job position as a NICU nurse?
You always need to be willing to learn new things such as equipment, and you also need to have a big heart and be able to separate your work life from your home life.
What do you enjoy the most about your job as a NICU nurse, and what do you personally find the most satisfying?
Babies could spend up to 8 months in the NICU, and the most satisfying part was watching them go home after you spent so much time making sure they would be able to get there.
What do you enjoy the least about your job as a NICU nurse?
When the babies don't make it after all your efforts.
And what is the most challenging part of your job as a NICU nurse?
When the kids don't improve and you try everything you can to help them improve, but they're not getting any better.
Do you have any advice that you would give to anyone that is interested in working as a NICU nurse?
Just know it's difficult, challenging, and stressful, but it is all worth it in the end, and the rewards outweigh the difficulties.
Now to reflect back on your education a little bit, I just have a couple questions. As you reflect on your basic nursing education, is there anything in particular that prepared you for your current role as a NICU nurse?
I believe clinicals helped a lot, and once I had babies of my own, it kind of helped because you have a different perspective as NICU nurses that are not moms.
And can you provide a specific example from your practice that illustrates the importance of the role?
About 30 years ago, there was a set of quints born, and I became really good friends with their mom, and I still keep in contact with mom and all the quints.
Do you have anything else that you would like to share with me about your job as a NICU nurse?
The length of time I have worked as a NICU nurse proves that I believe I make a difference to the babies and the families' lives.
All right, I think that's all the questions I have for you today, Michaela. Thank you so much.
Thank you.
Here's a video regarding the evolution of NICU nursing.
Rainbow's neonatology faculty and our neonatal intensive care unit enjoy a well-deserved reputation for excellence across the world. Many of the treatments, the interventions that are now used worldwide to successfully treat very, very fragile babies were developed right here at Rainbow. The start of the first intensive care units were literally moving the tiniest babies closest to the nurse's station. And then it was recognized in the 1950s and 60s that babies really deserved and warranted a unit dedicated to their care so that the experts could be developed both in the physician care as well as in the nursing care. And our first NICU was very modest compared to our current NICU, which is absolutely beautiful. Each baby has their own private space. The floors are rubberized, so the noise level is reduced. All of the baby's cardiorespiratory monitoring is connected to a nurse call system so that those alarms are silent alarms. And the families just have an atmosphere where they could bond and get to know their baby. What we have here is really, really special as a team, and what we contribute is pretty extraordinary.
So here's a couple pictures showing the evolution of NICU nursing. The top 3 pictures are the dated ones, and the bottom 3 pictures are the new up to date. And you can see there's a drastic change from the incubators in the first picture compared to the 6th picture.
So the evolution of the NICU at OSF has occurred over many, many years. It started in 1942. It was unusual to have any visitors many times, and the parents' first time to actually be with their child was at discharge. And that continued into even the 60s, where the parents were the only visitors allowed for very specific hours and days. But as time progressed, visitation was extended, and it was still only allowed for parents, but you could extend scheduled visits. In the 1980s, the people who could visit was expanded to grandparents. And again, in the mid 1980s, when siblings were allowed to visit as well. In the 1990s, they developed protocols for the yellow gowns, which are required to be worn even now. And in the 2000s to current, 24-hour visiting is allowed for up to 4 people at a time, and each baby has their own room.
A day in the life as a NICU nurse. Typically, they work 12-hour shifts, 3 days a week, for a total of 36 hours a week, and sometimes they do get overtime. There is no average day as a NICU nurse, as no 2 days are ever the same, since they are always seeing a variety of different things. But they do start and end the day with report. They also do things like take assessments, pass medications, watch monitors for changes, interact with families, and include them in the care, feedings, vitals, and documentation.
These are 2 videos that show a good representation of the day in the life of a NICU nurse.
It's something you can't really put words to, but just kind of that feeling of, okay, I did something good for this family, and it's a memorable moment. You know, people's lives change every day on my unit, and I might not remember every single one of them forever, but I know that they will. The more common struggle that we have in our setting is just nobody wants to be in the NICU and under any circumstance. That's not what anyone signs up for or thinks is going to happen. And so just the whole grief process, even if the baby ends up leaving perfectly healthy when it's all said and done, helping guide the family through losing the experience of having a happy, healthy delivery is really hard for people, and just kind of dealing with that and trying to explain why they really need what they need and what they need and how long they're going to be there. It's the number one question is, when are we going to be able to go home? And that always just depends on the baby and what they're able to do. If I've had a day where I've been able to do something like that, where I've given them some kind of space to create a bond with their baby that, you know, I'll never forget the first time I did fill in the blank, changed your diaper, checked your temperature, whatever it is, it really gives me a sense of like, okay, I did what I was supposed to do today. I kept the baby safe. I did my hard job, but I also helped them establish a connection and become a family.
Every day is really dynamic. Coming into the unit, you sort of have to brace yourself because you really don't know what you're going to be walking into. A lot of times there's very little warning, so you have to think really fast on your feet, be ready for anything. Or you can have a really amazing day where parents are given absolutely fantastic news that their baby's ready to go home. Caring for the extremely low birth weight baby is pretty amazing. If you can imagine, they can literally fit into the palm of your hand. Those babies are typically in an incubator, so you're navigating through the portholes of the incubator, and we have tiny little blood pressure cuffs, all the medical equipment that we would use for children or adults, but for these tiny, tiny little babies. The extremely low birth weight baby does have a long road ahead. There are many medical challenges that these babies face. The hardest part of my job is when a parent has to say goodbye to their baby, because I can't imagine as a mother or a father or a parent having to experience that. So in the last 17 and a half years, I have to say I've seen amazing progression on how we facilitate family-centered care here at Sick Kids. Parents weren't necessarily involved in rounds, but today we consider the parent to be an active participant in the medical team. It's encouraging them that yes, your baby's really sick, but you can still provide, you know, the normal baby care.
The benefits of NICU nursing is that they increase the survival rate of infants. They create a support for the families during the difficult times. And they also help educate the families on how to care for their little baby. There's a lot of advancements within the career. You can always go back to school and progress. And there's a ton of job security because there's always a need for NICU nurses.
The challenges of NICU nursing. So there's high amounts of pressure at all times, so you have to be able to handle pressure very well. The loss of a baby because of the relationships that the nurses have made with the baby and the families, which is a particularly hard thing to do in healthcare, is the loss of anyone, but especially when it's a baby. It can be emotionally draining, giving the challenges of NICU nursing. So there's high amounts of pressure at all times, so you have to be able to handle pressure very well. The loss of a baby because of the relationships that the nurses have made with the baby and the families, which is a particularly hard thing to do in healthcare, is the loss of anyone, but especially when it's a baby. It can be emotionally draining, giving everything you have to take care of a life and still have a negative outcome. I know that's very difficult. It's easy to get burnt out from working long shifts. And fatigue can also be seen from all the constant emergencies. So it's very difficult. It's definitely not an easy job, and it takes a special kind of person to be able to do it.
Our final thoughts. NICU nurses have high stress and difficult jobs. However, they are making an impact in saving lives for the next generation of possible NICU nurses. NICU nurses are strong, passionate, loving, and selfless, and they have an everlasting impact on their patients and their families' lives.
And lastly, we put together a mini quiz for you guys to test your knowledge. True or false? NICU nurses care for the elderly population. The correct answer is false.
True or false? NICU nurses typically work 4-hour shifts. It is false. It's typically around 12.
True or false? NICU nurses have a high stress job that demands a lot.
True or false? NICU nursing has never evolved. False.
What are NICU nurses responsible for? Monitoring vitals, INOs, tube feedings, medications, and many other things.
True or false? NICU nurses do not include families in patient care. False.
Are visitors allowed in the NICU? The correct answer is yes.
True or false? Each patient can have 6 visitors at one time. False. They can only have 4.
True or false? NICU nurses are under high amounts of pressure at all times. The correct answer is true.
Do NICU patients have their own rooms? The correct answer is yes.
And these are our references that we used with this project. Thanks for watching.